COVID and obesity. All right, so we're all dealing with COVID right now. And the one thing, we haven't been able to say this for 100 years. Everybody, no matter where you are listening to this lecture, you are dealing with coronavirus, okay? We are now seeing, particularly here in the United States, that because of our 40% or larger population of obese people, we are having correlations between bad COVID infection outcomes and body size. Okay? So, why does bigger body size lead to worse COVID sickness? Well, there are a couple theories. One is that the larger you are, is the more pro-inflammatory chemicals that your body is creating and circulating because you've got more tissue to circulate in. The more pro-inflammatory chemicals you have, that is telling us that you are not able to process a lot of the foods that you're ingesting, like the fats, the sugars, and the salts. And the American diet, and increasingly the world diet, is full of fast food, fat, sugar, and salt. So if you now get COVID infection, you're less likely to be able to handle that infection because you already have a baseline inefficiency to deal with any metabolic abnormality or infection. Okay? When you're large, particularly when larger people lay on their backs, you can see that they may have what we refer to in medicine as increased work of breathing. The harder you have to work to breathe is the less your lungs are going to move in and out. The less your lungs move in and out is the less you're able to clear infection from your lung. The more you're going to get what's called atelectasis, which is when your lung can't move, it essentially collapses, and atelectasis only leads to trouble. That's why after surgery, every doctor is telling you, Mr. or Mrs. Johnson, or Mr. and Mrs. Ramirez, okay? Move, get up and move, get up and move, okay? The larger you are and the less you're able to move is the higher risk you have of never leaving this hospital. I'll be honest with you. Younger people getting COVID in the United States are seen to be correlated with larger size. This started in China and Italy as their COVID surges happened before the US, and now we're seeing it in the United States. Men are also having worse outcomes with COVID than women are, being of equal size. And that may be because male fat is more stored in the belly. Female fat is more stored in the hips. Now you can imagine if you're laying on your belly and you have a bad COVID infection and you're on a machine to help you breathe because you can't breathe on your own and your kidneys are failing, the fact that you've got this major abdominal fat mass of living, breathing tissue working against you is not helping. Recent Kaiser Permanente study showed that BMI of 40 or more is considered obese, extremely obese, and those individuals have a 3 times greater risk of dying of COVID disease if they're infected. If you're 45 or greater BMI, you're 4 times at risk of dying. And men under 60, okay, have shown huge risks of dying when they're obese. By the way, normal BMI is about 18 to 25. And if you're 25 to 30 about, you're considered overweight. So everybody needs to, when they're done with this lecture, you need to check your BMI or ask your doctor to check your BMI and see where you fit. So this COVID obesity correlation is real. And a lot of it is because we already existed as a large society. Now here in the United States, Latino people and Black people, which a totally different lecture as to what means Latino and Black. I always say that. Remember, race is an artificial classification. It doesn't really exist in real life. We just make this up. So Latino people and Black, we'll just go with what we know. right? If you're Black and Latino, then you're even double screwed, right? You're more likely to be obese, and you're more likely to have poor access to healthcare and have all of these other diseases. And as a result, you're more likely when you get sick with COVID to have a poor outcome. Simple as that. It's not necessarily because Black people and Latino people have genetic predispositions to die from COVID. They're bringing body and health issues that make their COVID infection more efficient, if you will.